Hi everyone, my name is Shilpa and I'm a fourth year Bachelor of Science student at McMaster University and also a volunteer at the South Asian Canadian Health and Social Services. So today we're going to be giving you some updates on COVID-19, prevention strategies you can use, as well as coping with your mental health during these times. So the agenda for today's video is to first talk about the current state of COVID-19 in Ontario. Next, we're going to talk about the possibility of a second wave of cases coming in Canada. Next, we'll talk about the reopening of Ontario schools. Then we'll refresh your memory about COVID-19 prevention strategies and the symptoms. Next, we'll talk about the state of future vaccinations and what that looks like in Canada. And lastly, we'll be talking about how to cope with your mental health during COVID-19. This is what the current situation of COVID-19 looks like in Ontario as of September 3rd. There has been 42,800 in total cases of COVID-19. However, 38,000 of those have been resolved cases. Unfortunately, we've had 2,800 deaths, but 1,800 from them coming from long-term care homes. On a bright note, we've had 3 million people tested for the virus in Ontario. As we are currently in stage 3 of the governmental plan of action, we have seen fewer restrictions put in place. We've seen restaurants, playgrounds, movie theaters, beaches, etc. opening, and people are taking advantage and using these facilities. Just to keep in mind of some of the restrictions that are still implemented on gatherings is that we have max of 50 people for indoor gatherings and a max of 100 people for outdoor gatherings. And as always, you have to make sure you're physical distancing of 2 meters and wearing a mask when required. So there's been a lot of discussion about a second wave coming to Canada this fall. As we're in phase 3 and with less restrictions mandated by the government, we have seen an increase in COVID-19 cases so far. For example, Ontario recorded its 9th straight day with more than 100 new cases towards the end of August into September. The GTA growth is now also fueling an overall province-wide increase of cases. So the question is, can we prevent a second wave from occurring? And health experts say yes, we can. Through aggressive tracking, tracing, and testing, we need to identify who has COVID-19 to prevent a larger outbreak from occurring. In addition, we need to continue to physically distance from one another, wear our mask, and practice good hygiene to prevent a second wave from occurring. So the next thing we're going to be talking about is the reopening of Ontario schools, which are happening next week. And just to give you an idea of what that's going to look like and the plan of action that the government has, I'll be going through some of the safety protocols that will be enforced. So in elementary schools, kindergartens through grade 8 will be required to attend school 5 days per week, and students from kindergarten to grade 3 will be encouraged to wear a mask, but it's not required in indoor spaces. However, students in grades 4 to 12 will be obligated to wear a mask indoors on school property. In addition, in several secondary school boards, they'll be having a modified class model where they will have approximately 15 students attending on alternate schedules. Also, all staff and students must self-screen every day before attending school. Students with sensory or breathing difficulties may be exempted from wearing a mask. As well, distancing as much as possible between students and staff will be implemented within classrooms. School clubs and organized sports are able to happen as long as there's physical distancing and equipment is cleaned and disinfected between each use. Also, schools are asked to significantly limit or even prohibit visitors, including parents. If you're a parent of a child entering school this fall, please be cautious and aware of your child's health daily. Educate them on practicing good hygiene, how to wash their hands, keeping on their masks, and physically distancing from others. And also maybe try to get a designed mask of their choice to ensure that they keep it on all day. And if your child is sick and have symptoms of COVID-19, ensure that they are not attending school in person. As we have mentioned in previous videos, I wanted to reinforce the prevention strategies that you can use to ensure that you don't contract COVID-19 or transmit it amongst others. So the first thing you can do is make sure you're washing your hands after touching surfaces, because the COVID-19 virus is transmitted through respiratory droplets, and these droplets can remain on surfaces for hours. What else you can do is cover your mouth when you cough or sneeze. Avoid touching your eyes, nose, and mouth. Social distancing 2 meters between others and wearing a mask when in public spaces. And as well, isolating yourself in quarantine if you do contract the virus. Symptoms that you should look out for are fever, runny nose, dry cough, shortness of breath, fatigue, and body aches. Also, make sure you download the COVID Alert app on your Android or iOS device today. This app notifies you if you've been in contact with someone who has tested positive for COVID-19. If you want to get tested for COVID-19, I provided a few centers on the slide, which include Credit Valley in Mississauga and the William Osler Hospital in Etobicoke, as well as Brampton. To look for a COVID-19 testing center near you, go to covid19.ontario.ca and look for assessment center locations. There's been a lot of discussion about the state of future vaccinations in Canada. However, the World Health Organization says that they do not expect a wide use vaccination until mid-2021, and they will not endorse a vaccine that's not effective and safe. Researchers are currently testing 37 vaccines in clinical trials on humans, and at least 91 preclinical vaccines are under active investigation in animals. In addition, the Government of Canada has entered into 2 agreements with Pfizer and Moderna, 2 pharmaceutical companies, to secure millions of doses of potential COVID-19 vaccines. And if a vaccine does become available next year, there will be a potential problem about who will get the vaccine first, as well as its availability. Those who are going to be getting it first will be people with chronic medical conditions, pregnant women, children under the age of 5, and healthcare workers, because these are more at-risk groups. And so until the time that a vaccine is available for use, we have to make sure that we are still physically distancing, and then we're still wearing masks and using the preventative strategies that I provided on the last slide to ensure that we don't get a rise in cases this fall. The COVID-19 pandemic may have resulted in a lot of unexpected and sudden changes in your life. You may feel like you're no longer in control of things, and it's normal to feel sad, stressed, scared, or worried. Many people are going through similar feelings, and everyone reacts in a different way. Some common feelings may include a fear of getting sick with COVID-19 or making other people sick, worried about losing your job and not being able to keep up with your finances, concerned about your children's education and well-being, as well as a fear of being apart from loved ones due to isolation and the loneliness, boredom, and depression that comes with isolation and physical distancing. I provided a few tips that you can use to take care of yourself and take care of your mental health during this time. One of the things I would do is to stay informed of COVID-19, but to take breaks from social media and the news. There's a lot of information out there, and it can be overwhelming at times and can add unnecessary stress. So make sure to take a pause on the social media and news from time to time. Next, it's important to stay socially connected with friends and family through video chatting and through phone. You can also meet with each other, however, make sure to ensure physical distancing of 2 meters apart and wearing masks at all times. Next, I would ensure that you practice mindfulness. Meditating, stretching, and taking deep breaths are really important for a clear mind and an overall better well being. Also, you can focus on the positive aspects of your life and the things you can control. In addition, eating healthy meals, trying your best to exercise daily, and getting plenty of sleep and rest is important for your mental health. Also, limiting your substance use and taking up new hobbies or passions during your free time will help you relieve stress. So I provided a list of resources and services that you can use to help you with your mental health. One thing that you can do is call your primary health provider, a registered psychologist, or a mental health provider in your community to get one-on-one help over the phone or through video chat. As well, you can call Kids Help Phone if you're aged 5 to 29, 24 hours a day for people who want confidential and anonymous care from professional counselors. As well, there is the Hope for Wellness hotline, which is available to all Indigenous people across Canada who need immediate crisis intervention. You will be talking with experienced and culturally sensitive professionals who can help you if you're feeling distressed and if you just want someone to talk to. As well, there's the Crisis Service Canada phone line. The GTA number is provided on the slide, and you can contact and talk to support workers, professionals, and psychologists for a confidential chat session by phone call. If you need immediate help, text wellness to the numbers on the slide for youth and adults. So thank you for listening to this video, and I hope that it has helped you stay informed and updated about the state of COVID-19 in Ontario, what you can do to prevent yourself from contracting the virus, and how to cope with mental illness during this time. If you'd like to talk to someone about your mental health, you can always contact the South Asian Canadian Health and Social Services to talk to one of our mental health providers and schedule a telephone or video call. All of our contact information is on this slide. I hope that everyone stays safe and healthy. Know that we are all in this together. Have a great day.